mental health has obviously been an important topic. It's on the rise, and it's hard to talk about. So today, hopefully, we'll be able to be a little bit more comfortable talking about it. I do want to point out, if you look at the logo here, you see the big Iowa logo. I am at the University of Iowa, but I direct a center called the Healthier Workforce Center of the Midwest, which serves all of Federal Region 7 and beyond. And so we have partners in Nebraska, Missouri, and Kansas, and many of them help to contribute to some of the stuff I'll be talking about today. Please do ask questions. We can ask anything, and hopefully this will give you some tips and things you can use. So as I said, mental health has been on the rise here. And today I want to really understand why that's happening and why we need to think about it from the workplace perspective. And that's a really important thing because that's where we spend a lot of our time there. I also want to give some information on how to recognize the warning signs and then what to do to address them, or how to talk with someone who may be in distress and help them to find resources. When I do this presentation, I like to start out kind of with the end goal here. And this is a definition of good mental health. It's from the World Health Organization. And if you read it, it's a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. And so this definition really talks about where we want to be. But you might notice the word happy isn't in this. You might think, well, isn't that what we want when we think about good mental health? And it isn't, because we know life goes up and down and we have good times and bad times. But what we want is to be able to cope with those stressors and not have it interfere with our activities of daily living, working, being with the family, having a social life. So that's what our goal is. So my research and others' research, there's a ton of stuff that shows that work influences health and well-being. There's an interaction between the two of them. Over 2/3 of Americans work. We often spend more waking time each day at work than we do with our families. It impacts health and well-being both positively and negatively. It does give us a sense of pride, identity, and it's a measure of personal achievement. Think about those great days when you're like, yeah, this is my job and I'm doing it well. Often it's our social support. You know, we spend a lot of times with our coworkers, and they are people who know maybe the most about what's going on in our life, and they're there to support us if things aren't good there. We're happier and healthier if we're working. And, you know, our physical and mental health in general is improved through work. But there are times when it's not, and there's times when things outside of work can also influence our mental health. So trying to understand that balance between health and well-being and the role work can play is one of the goals I have for today. And when we think about the workplace, we talk a lot about safety, but mental health is often ignored. And when I'm talking about mental health today, I'm talking about the 3 circles you can see on the slide. So we have mental illness, which is actually a physical diagnosis. It's depression, anxiety, bipolar disorder. But mental health also includes substance use. This could be alcohol, could be binge drinking, could be pain medication, marijuana. You know, and those are things that people often use as coping strategies. So mental illness and substance use can go hand in hand. And then the 3rd circle is work stressors. And this is an area where we in the workplace can really start to address it. And we'll talk more about that later. So mental health is really thinking about our emotional, psychological, and social well-being. Our mental health impacts how we think and act. Sometimes it's really hard to make decisions if you're experiencing a lot of stress, even simple decisions. And that can be a problem if you're in the workplace or trying to raise a family there. The other thing about mental health is that it changes over time. It doesn't stay the same. And things like genetics and also life events can impact our mental health. There are times of the year where some people may find, you know, the holidays particularly stressful, and, you know, that will ebb and flow. There's also life events like getting married, having a death in the family, children who are maybe not doing well in school that can impact your mental health. So it changes, and we need to remember that, is that, again, we're not going to be happy all the time. I'm a researcher, so I got to give you statistics. This is data from the National Association of Mental Health, or NAMI. I might not have gotten that right, but 1 in 5 adults in the United States have a diagnosed mental health disorder. 1 in 5. So think about that, and think about the people we have on the call. So it's impacting a lot of lives. 1 in 10 adults in the United States have a diagnosed substance use disorder, also impacting a lot of lives. The third bullet is something we want to think about, though, is even though we have a lot of people who are diagnosed with these conditions, the time between when they first started experiencing symptoms and when they actually got treatment is 11 years. That's over a decade. So they've been living with these symptoms for over a decade before they seek help. And only 45% of adults who have a mental illness get any treatment. So half the people aren't getting treatment. And this is important because treatment works. And there's a ripple effect from mental health here. People with depression have a 40% higher risk of developing cardiovascular metabolic diseases. So your mental health is going to also start impacting your physical health. As I mentioned, 32% of adults with mental illness also experience substance use disorder. We see higher unemployment among adults with mental illness. And that's important because, I think most industries right now are experiencing a labor shortage. It's hard to hire people and hard to retain them. And if we can address mental illness, we can also increase that labor force, which is going to help everybody in the long run. In addition to the individuals that are experiencing or living with mental illness, we also need to think about the people that provide care. And that can be as stressful as somebody who is experiencing with it. So this mental health has big implications, not only for an individual, but for their family and the workplace and even society and beyond. Other facts we're seeing is deaths by suicide are increasing. I'm showing Iowa data here. This is a national trend. And what we know, the Midwest, which is where we're all located, also has a higher rate of deaths by suicide than the national average. And it also is higher in rural areas, which is where many of us are living and working. So this is a trend that's been going on for 20 plus years, and it's starting to be very concerning. The figure on the right is looking at different industries. And, we see that the rates of suicide are higher in certain industries compared to the general population. The highest one is the mining and gas extraction. That's the yellow bar there. But construction falls second in that gray bar there. Installation, repair people are the black line, and then the lighter gray line is agricultural, forestry, fishing, and hunting. And again, in our rural areas, that can also impact a lot of the people we're working with there. So certain industries have higher rates of suicide. Now, when we think about suicide, sometimes we think it's associated with mental illness, and it is in some cases there. But when we look at risk for suicide, we see that in addition to depression and mental illness, there are other factors that can contribute to suicide. And if we look at what I have on the slide, we see relationship problems is a big factor, and substance use, job or financial problems, physical health problem. These are all things that we've probably experienced at least one of these at one time or another. But also think about how many of these factors on this slide are related to work. Relationship problems, maybe because you're working away from home and you're not seeing your family. Relationships probably could also be with your boss or your coworkers. I like to think we all treat each other nice in the workplace, but sometimes there is bullying and harassment, incivility, and that can definitely impact your mental health. Construction has very high rates of drinking and binge drinking. And so those are issues we need to think about too. So why are we seeing the higher rates in certain industries? Well, there's a couple of factors that are common across these. The industries that I talked about tend to be male-dominated industries, and there's a tough guy culture. You don't want to admit weakness. You're going to power through it, you're going to work hard, and you're just going to get the job done. And that's a great quality in a workplace, but it also is not a quality that is open to seeking help if you need it. These industries also have high job stress. Sometimes the work is seasonal, so you may have periods of unemployment. There's other times too where you are working up against a deadline. And if you get behind, that's going to have big impacts maybe for your organization, but also for the other contractors who are working on site. There may be a financial implication. These are stressors that people face every day. The industries that we talk about are also very physically demanding, and there are high rates of injuries. And so people, when they become injured, may go to their physician and they may be prescribed prescription pain medications. We've been talking more about opioid use in the workplace, but we do know that that is still a problem, especially in the construction industry. The other factor is, you may want to work through the pain because you want to keep working. If you're not working, you may not get paid, or there may be a risk of losing your job. So even though you're in pain and the best thing you could do is rest, you may try to work through it, and that may mean you're taking more pain medication to try to make it through the day. Access to mental health resources is a problem. We don't have enough mental health providers here. And if you're working on site, you may not be able to take the time to access them during the workday. High rates of alcohol use, high access to lethal means. There's some big equipment. There's ways to think about harm, and also low job security. So when you combine all these factors together, that is why you're starting to see higher rates in certain industry compared to others. Specifically, suicide rates in construction are 4 times higher than the general population. And you are more likely to die by suicide in the construction industry than you are to die from any other workplace injury. I see a comment in the chat about workers owning a lot of guns. That's part of the culture living in rural areas involved in hunting, also access to lethal means. So thank you for sharing that. So when we've surveyed construction workers, and this is work that was done by other researchers there, and we asked them about their experience with mental illness. And we found that 1/3 of those surveyed reported experiencing a mental health condition in the past year. 1/3. 3/4 felt that their employers did not recognize the early signs of mental illness. So the employers had no clue what was going on with this individual there. About half of them took time off, didn't tell their employers the reason for their absence. So they would just take a sick day, but they wouldn't explain what was happening. And there's a reluctance to talk about your experience with mental health, and you're worried about the stigma or the consequences of talking with your employer and how you might be treated differently. And one of my goals here is to try to reduce that stigma and make it okay to talk about mental health. I want to kind of give a shout out to women in construction. We know their numbers are low. They're only about 11% of the workforce there, but more than 70% of them experience harassment or gender bias in the workplace. So those are those relationship issues in the workplace stressors that I'm talking about. But even though we see over 70% experiencing this, only 12% are reporting it to HR, and only 20% even reported it to their manager, their frontline manager. And a lot of them just left because they don't want to deal with it. So when we think about addressing mental health, we want to think about populations where we don't have a lot of numbers. And we want to make sure that they're having the support that they need and that they have a community that can help them. So why are we doing this? Because the good news is mental illness is treatable and life can get better. And where there's good evidence that things like medication, therapy, diet, exercise, and just support in general are effective ways to help treat mental illness. So even though these numbers are shocking, even though, this is not where we want to be, we can change this. Recovery is possible. So that's another take-home message. So if recovery is possible and treatment works, why are people not seeking help? And there are 3 reasons. One is a lack of awareness. We need to start talking about it. We need to start recognizing that people may need some help. They may be in distress. And what are some of those signs, warning signs that they are? So that's one of the goals of this presentation. Another thing is it's hard to find resources, and knowing what's available in your benefits program, whether you have an employee assistance program, what's available for the union for you and your family is important. And then finally, stigma. Stigma is stereotyping or labeling someone because of their condition. And if we can reduce the stigma, people are more likely to get help. So stigma is, when they ask people what they thought mental illness was related to, what causes mental illness? People said things like stress or a lack of willpower. You just got to power through. You got to, just pull yourself up by your bootstraps, or it's a sign of weakness. I made it through this. I had the same troubles everybody else did. I don't know why they're not handling this. And the problem is that mental illness is not something you can just overcome by sheer willpower. It is actually a biological condition, just like diabetes, just like cancer, just like heart disease, and it needs to be treated the same way. And so that stigma that, oh, just get over it, that's not going to help anybody. So we need to recognize that. Why the workplace? It has a huge impact on performance in the workplace. First of all, you might see that people don't come to work or they're late coming to work, which can impact things. It will impact their physical health, so they'll start to develop other health conditions that can make them unable to come to work. Their performance may be off. They may not be following the right steps, doing the right tasks, taking care of the safety procedures. Presenteeism is when people come to work, but they're not really focused. They're thinking about other things. They're not paying attention. They're not there 100%. And that can be a problem for safety reasons, but also with things like relationships with coworkers. And then morale. It's really hard to work with somebody who's not fully engaged. If the whole team is working hard and somebody isn't, that's going to be discouraging. And we want to overcome that there. So why don't people seek treatment? The biggest concern we hear all the time is confidentiality. I don't want anybody to know. And that's that stigma talking. It's the fact that I can't talk about this. People will think I'm weak. People will not want to work with me. That's why I don't want to tell anybody about it. Also, people are worried about losing their jobs. If I tell my boss this, they're not going to want to work with me anymore there. Sometimes people are just not ready to address their problems. And even though it may be apparent to others that an individual is not doing well, if that individual doesn't want to address it, there's nothing you can do. Just be ready and support them there. And the final barrier is supervisors. They don't know what to do. They don't know what to say. What am I allowed to say legally? What can I not say? And they're just not comfortable with that. And so we need to get our supervisors more comfortable with that. The benefits of addressing mental health, this is more for your boss and your employer. It's going to increase productivity. We're going to see fewer injuries and illness. The healthcare spending, so whoever's paying your benefits, is going to go down. We're going to see less turnover and more engagement. These are all things that we want to have in a healthy workplace. Mental illness is one of the most costly health conditions in the United States. It costs more than cancer, obesity, heart disease, and stroke. So makes good financial sense to address that. And if you do address it, it has an impact. 80% of employees who received treatment for mental illness reported they were more efficient at work and they had greater satisfaction. And that means they're more productive there. So if you need to make the case, there's a lot of workplace mental health calculators or substance use or depression. The National Safety Council has put them out. You can use the QR code and see what it is actually costing your organization. And the return on investment is pretty good. For every dollar you spent on addressing a mental illness, you get a $4 return on investment. I've actually seen higher costs in more recent surveys. So it is worth addressing in the workplace. So let's switch gear and think about how should we address it. And a lot of times when people talk about mental health, they go to individual solutions or self-care strategies. And they say, you should think about taking care of yourself, making sure you're getting enough sleep and you're eating right. We may talk about maybe some meditation or mindfulness, and these practices, there's actually very good evidence that they are effective. Meditation, mindfulness, those practices are very effective for stress and burnout management. Maybe it's creating a space where you can take a break that's quiet and let you collect your thoughts there. So they're good, and some people want these programs and others do not. And that's okay. The other problem with these programs, though, is that they're only targeting the individual and they're not getting rid of the hazard. You're still going to have all of those stressors once you leave that quiet space. And so we need to think beyond these individual solutions. But these are good and they can have a place in this. So when we think about addressing mental health, I want you to focus on organizational, not individual solutions. So individual solutions that we just talked about are, think of even like a smoking cessation program or PPE, that benefits one individual, one worker. Now, if we can step it up a little and maybe train some supervisors on how to react to this, to recognize signs and symptoms, giving some confidence in how to talk about it, we're going to impact everybody in that work group. So we're going to have a broader reach. If we can go to the organizational level and think about policies to put into place, if we can think about addressing other workplace hazards, we're going to impact everybody in that organization. So my goal is always to get to the most effective interventions, which are at the organizational level. You can do the individual ones, but let's go higher and impact more people. So another thing is prevention is better than the cure. It's better to stop something bad from happening than it is to deal with it after it has happened. And I have the OSHA top 10 most frequently cited violations. If these were going on in your workplace, you're not going to treat the guy who's falling off the roof or the ladder or gets caught in the machinery. You want to prevent that from happening. And that's the same thing we want to do with mental health, is we want to recognize what are the hazards that are impacting our mental health, and let's start eliminating them and reducing them. So speaking of OSHA, OSHA's gotten behind thinking about mental health in the workplace, particularly in the construction industry. So they, since 2020, they've been holding Stand Down for Safeties. September is Suicide Prevention Month, and that's usually when the stand downs occur. You may have participated in those. And this is a great opportunity to get involved. And it's great that the people who are designed to protect us from injury and illness are also thinking about mental health. We are fortunate. We have an alliance agreement with OSHA and Federal Region 7 and Iowa OSHA to address mental health and substance use. And that's a way we try to partner with them to promote good mental health. So what are organizational strategies? Okay, first of all, just like any safety hazard, you have to remove the workplace hazards. So you have to create a safe, hazard-free workplace. You get it if it's a fall, if it's working from heights, unguarded machinery, chemical exposures, noise. I think everybody here knows how to address those. What do we do in this situation? Well, we want to define roles and responsibilities. We want people to know what their job is. An easy example is my son worked as a stocker in the grocery store. He was stocking, no, it sounds terrible. He was stocking the shelves with the groceries, and he worked at the night shift. And sometimes, he would come in and they wouldn't get it all done. The morning manager would come in and would say, hey, you got to get these pallets out of the aisles. We got people coming in. But his boss had told him, no, you can't leave until these pallets are emptied and put away. So here he is. He's like, oh, what do you guys want me to do? So things weren't clearly defined, and that's something we can eliminate. Think about work schedules that are compatible with demands on and off the job. If you have to travel for work and you're living away from your family, think about creating longer periods of time or more frequent opportunities for workers to return home to keep that connections with their family. Compensation's a big one. If you're not getting paid what your buddy is, that's going to be an issue. And then making sure that our workers are trained to do the job they're assigned to, that it matches their capabilities and the resources. So if you have to do a job, make sure you have the right tools to do it. Can also think about workplace policies that address mental health and substance use. And you really want to create a culture that reduces that stigma and supports recovery. I'm not going to talk about it today, but this is kind of where recovery-friendly workplaces come in for people with substance use. But it's complicated, but that doesn't mean we shouldn't do it. So first thing is identify workplace hazards. And a lot of times I may have you do, if I was in person, a hazard mapping activity, and I'll show you a picture of that. And I'd say, okay, draw a picture of your workplace and then go ahead and tell me what the hazards are and add them into your picture there. And so most people start with the bottom left-hand corner of this slide. They're going to talk about noise. They're going to talk about vibration, air quality, poor lighting, equipment that's unguarded or doesn't work, repetitive motion and other ergonomic hazards there. And these are the workplace hazards. I'd like to think of them as traditional ones, but then I think we need to expand beyond those and think about how is the work designed, what are the practices, and think about those relationships there. So if you've got long hours, low pay, and unrealistic deadlines, and you're worried about losing your job, that's a workplace hazard there. Frequent turnover or not having enough workers is a workplace hazard. That transition there means people are doing more and their jobs may have expanded there. Things like mandatory overtime, poor supervision, having multiple supervisors, kind of like my son's there, and poor communication are also hazards. And then those relationships, like I talked about before, bullying and harassment, being away from your family, or supervisors that maybe aren't the best communicators. These are all workplace hazards, and they can impact our mental health. So we need to treat these the same way we would with any other workplace hazard. And so when I teach, I talk about using the hierarchy of controls. The most effective solution to control a workplace hazard is to eliminate it or to isolate it. So we want to reduce the excessive workload. We want to have a zero tolerance for bullying and harassment. We want to make sure that people know what their jobs are. And those are easy things that you can do. Some of them are easy, but they're things where you can start to do that to change the culture. We can also think about training and communication and maybe job rotation to improve the work practices. Those are other ways to control some of those hazards. And then, at the bottom where we would have our personal protective equipment, think about those individual solutions, those quiet spaces, or maybe noise canceling headphone if somebody has anxiety, or the mindfulness or meditation. But recognition is also in here. And that is a low cost, no cost way to really support your employees by recognizing the work that they're doing. So keep that in your back pocket and see if you can implement that. So again, organizational level, most effective solutions, that's where we want to be. Here's a picture of the hazard mapping. It's always fun to do. If you want to do it, we have a video and some information that explains how to do it. It's a really great way to bring people together. And the way it's done is you want to have people at all different levels in a group that are doing this together because you're going to learn from each other. And the solutions that you come up with to control these hazards are going to be more innovative because you've got different perspectives. The other big factor is leaders need to talk about mental health. So surveys have found that 60% of employees reported symptoms and 60% never talked about it at work, never told anybody. They were least comfortable talking with HR and their senior leaders. So they may have said something to their coworkers or their direct supervisor, but it's not getting to the people who need to know what's going on. And one way to do this is to have our leadership start talking about mental health. They need to share experiences, advocate for this, and that's a way to start to normalize the conversation and make us more comfortable. And you might be thinking, well, this is private, this is personal. So you can share a story if you've had a life experience that has been difficult and you're comfortable. That certainly will be impactful. But you could also share something. One supervisor told his team that, he had just gone to his physician because he was having trouble coping with some things. And he is starting some medication. He didn't explain why, didn't explain what was going on, but he just said, hey, it's okay. I also struggle with things and sometimes I need help. And that's why I went to my physician. So you can start just talking about it. And when you normalize it, people are going to start to share with it. Another example is one manager kind of does at the start of every shift a thumbs up, thumbs down, neutral to get kind of a feed on where everybody is that day. And if you notice somebody's thumbs down every, for a week or two, then you probably want to ask them what's going on there. The issue is the managers need training. And I think that's part of why I'm here today, is to start normalizing conversations about mental health and give you some tips on what to say. The other thing is know what your policies are in the workplace. And if you don't know, ask. And you may hear it when you're hired, you may hear it, once a year, but talk about it as much as you can. And you can have a campaign. I know you guys did a campaign this year on suicide prevention. We were happy to work with you on that. That's just a way to get you talking about it. You can also use screening tools or surveys to monitor where people are at. They don't have to be long, could be thumbs up, thumbs down, but you could do a quick survey just to check in with people. So we got to get our leaders involved here. So what would you do if a coworker came up to you and said, I've just been diagnosed with diabetes. I'm seeking treatment, but I may need to change some things at work. So as a coworker, you may want to be supportive and say, hey, can I help out with anything at home or at work? Or if you need some help, getting things done at work, I'm ready to help with that. Your direct supervisor is going to be, okay, let me know what you need. Do you need time off to go to appointments? Or, maybe you're not going to be feeling well till you get the medication working. That's good. We're all going to jump in and rally behind it. And that's really important. That's what we want to do. But what if a coworker comes to you and says, I've just been diagnosed with depression. I'm seeking treatment, but I may need to change some things at work. Well, I think we all agree we know what we should do, but it's really hard. Sometimes your inclination is maybe to say, oh, sorry, and I gotta go. But your response to the second individual should be the same as when somebody talks to you about a physical condition. A mental illness is a biological condition, and we can talk about it, and we can support employees, whether it's depression, addiction, eating disorder, anxiety, bipolar disorder, schizophrenia. These are some scary words. Bipolar disorder, what does that mean? Schizophrenia, post-traumatic stress disorder. We need to learn more about what they are, but not be afraid of them, and know that there is treatment available there. And also know that things like postpartum depression can also be a real issue. So knowing that and asking questions and seeing how we can support people is important. So I want to play a short video. Iowa did a Make It Okay campaign to talk about mental illness and reduce stigma. And part of this was having people share their stories through videos. So I want to have Sherry tell us about her experience.
One of the experiences that was difficult for me was being hospitalized inpatient for depression. And I found it personally to be something that felt like a failure. And so when I went into the hospital, I did not know what to expect. And it was very different from other hospitalization experiences for a physical illness. And I found that people did not call, people did not come by, people were afraid of what the hospital setting meant and how you access that part of the hospital. And so it was lonely. It was a very lonely time.
So when you listen to Sherry, she talks about hospitalization, and that seems like a big thing. But what she's saying here is she wanted people to reach out. And, she had some stigma here. She was afraid to tell her senior leadership. She didn't talk to them about it. And that led to her, feeling a little isolated and not in touch. So we need to remember that if somebody is not doing well or we don't see them, ask and inquire about them. So, raising awareness about mental health, mental illness is a way to reduce the stigma. And when the problem with stigma is that it's preventing people from getting treatment, and treatment works. You can get better, you can recover. So if we can start talking openly about this and making an environment where you can share that I'm just not doing well, and I may need some help, that's going to reduce the stigma and help people to get treatment. And, it's never too late and never too early to get help for a mental illness. The sooner we can get people to treatment, the sooner they can get to recovery. So training and supervisors, I see some comments in the chat about educating people. Yeah, that's what we want to do. And there are a lot of resources out there. There's what we call gatekeeper trainings, which is a little bit what this is. And this is a way for people who don't have a background in counseling or psychology or mental health to be comfortable talking about mental illness. So mental health first aid and QPR are two programs there. There's also something called bystander training, which was launched by the Iron Workers. And this is a program to stop bullying and harassment in the workplace. And what it is it's called Be That One Guy. And if you see a situation where a coworker or somebody is bullying or harassing or telling inappropriate jokes, be that one guy that speaks up, that says, hey, come on, we don't need to talk about that here, or change the subject. Well, okay, what do we need to do today at work? And sometimes it just takes one person to change that culture, is to, when you see this going on, find a way to divert it. Be that one guy that speaks up there. Another approach is a campaign. And as I mentioned, I think last fall, LIUNA the Midwest Laborers did the suicide prevention campaign in the workplace, which is a series of toolbox talks. They're short, they're designed to just raise awareness and get us thinking about it. And then there were the medallions that were handed out, and those have the suicide prevention hotline number on them. I don't know, I'm kind of curious if any of you participated in that. If you want to put it in the chat, that'd be great. It's always nice to know that was there. This is a campaign that was developed through the Associated General Contractors of Missouri. They're one of our partners, and they worked with us, and we've expanded it to serve the construction industry, but also other industries. But AGC Missouri also developed some toolbox talk on various mental health issues. And there's a lot of resources out. So it's easy for you to start to integrate it into the workplace and get the topics there. Yes, QPR, question, persuade, refer, is another great bystander training. And sometimes these are offered, through churches or schools. And if you have the chance, you can do it. Oh, and the cookies up at the top. This was a colleague of mine, worked in a manufacturing plant, and they wanted to have a campaign for their workers, but they wanted to make sure every worker was touched by the campaign. So they put the suicide prevention hotline on the cookies because they knew everybody would take a cookie. So it's a little things like that, just making it aware of it. And the medallions don't seem like much, but when you hand it to somebody, it's just a way of saying, I'm thinking about you and I'm here if you need me, or here's a resource. So as I mentioned, we have a shortage of mental health providers. This is a map. You can see where your county is. It's all the counties there. And the areas that in dark blue, the whole county doesn't have enough mental health providers. If it's light blue, there is no shortage of mental health providers. So the darker it is, the worse it is in that county. And you can see that Midwest area where we all are, we've got a lot of shortages there. Our urban areas are where we seem to have enough providers. And the reason this is important, because it's not always easy to get an appointment. Telemedicine, though, has grown a lot, and that is an option that can be put into place. And it's nice because you don't have to drive anywhere, and it means less time off from work. Another program that's been talked about a lot in the construction industry is peer support programs. These are people who maybe have been experienced mental illness, and they've actually made it through to the other side. They're in the recovery process, and they want to help people who are experiencing similar situations. And so they are trained to recognize and talk with people. They're not counselors, but they're a go-to person who can help get people to resources. And that's the real goal, is to support people and get them to resources. So what do we do? Okay. How do we talk about mental health? Well, the first thing to do is ask open-ended questions. You want to encourage people to share. You also want to empathize. You want to acknowledge their thoughts and feelings and experiences. So we never know what someone has experienced. We don't know if they're grieving somebody who has died, if they're worried about paying their bills, or they're worried about losing their house or their cars, if they're going through a divorce, if their kids are struggling in school, if they're in physical pain, or they're dealing with multiple problems at once. We have no idea. And so we have to remember that even though they look fine, they may not be fine. And so this is where we want to acknowledge their thoughts and feelings and experiences. And I'll get into a little more details here. You want to show that you're listening and understanding. So that could be making eye contact. It may be stopping and looking at them, and then repeating back to them on what you're hearing. And then know what the resources are. And if they're ready, refer them to resources that are available. So open-ended questions, what are those? Well, they're neutral and non-judgmental. So it's not your job to say, I don't know why you're experiencing that. That doesn't make sense. I'm doing the same thing and I'm fine. Nope, that's not neutral and that's not non-judgmental. So what should you say? You could say, I can see that something's upsetting you. What stressors are going on in your life right now? So try to figure out what are some of the challenges they may be dealing with. You could just say, hey, is everything okay? Is there stuff going on? Things all right at home? Or, we just are getting back to work. You worried about money? How are things going for you? For somebody who's new on the job, check in with them, do it every day the first week, then maybe once a week, how do you feel you're fitting in here? Are things going okay? You got a buddy to hang out with at lunch? Or, if you're away from home, what are you doing tonight? How do you unwind? What do you do for relaxation? Do you fish? Do you hunt? Do you like to watch sports, play basketball? And then what are things you're finding challenging? Is everything going okay? So just check in with people. You want to empathize. You want to acknowledge that things in their head, what they're experiencing, all of those have an impact on their life. And you want to, again, be that non-judgmental and trust and show you're there to help. So if somebody shares something with you like, I've just not been doing well lately. I'm not feeling well. I can't focus. I'm having trouble sleeping. They have given you a gift. They have shared something precious with you and they've made themselves vulnerable. And you may not know what to say, but you can always go back to this top phrase here. You can always say, that must be hard to talk about. Thanks for sharing it with me. That's all you have to say. It's like, wow, you're going through a lot right now. Thanks for sharing it with me. If you're comfortable, say, I'm here for you, or how can I help? But if you can't say that because you're not sure, just thank them for sharing it with you. You want to show that you're listening and confirm that you really understand what they're saying. You want to make sure that you understand what's going on. And so you might say, wait, let me see if I have this right. Are you saying part of the reason why you're having trouble getting to work on time is because, you and the wife are having some problems and getting the kids out the door is really hard? Or, your wife is home with the kids and she's struggling and she calls me and we're up late talking, confirm what you're hearing. Or you could just say, can you tell me more about that? What's going on? Sometimes, writing something on your hand may be good if you're worried about saying it right. The last thing is really referring people to support. I know it's surprising, and I know that HR and the leadership want to think we all know what our benefits cover. We sometimes have no clue. We don't know what resources are available. We don't know even how to reach them. And so we want to make sure that we promote that a lot in the workplace. Once a month, promote a new resource. Member assistance program, EAP programs, health benefits, a program that focuses on healthy eating, those are things people aren't aware of. And you want to emphasize that it's okay to seek help. We all are in a spot at some point or another where we need some help. And that's okay. It's actually a proactive way for us to handle stress, and it helps to build resilience. And a lot of people use these services. This is where the leadership talking about it, talking about how they've used them is important. Now, you can tell everybody about resources, but not everybody is going to be ready to use them. So sometimes it's nice to say, thank you for sharing what's going on with you right now. It sounds like you've got a lot to handle right now. And you might offer, would it be all right if we talked a little about some options that could help? Because they may just want to vent. They may just want to tell you what's going on, and they're not ready to seek treatment, and that's okay. But you want to reach out and say, we have a lot of resources. Do you want me to get some more information to you or not? Ultimately, it's up for each person to decide what resources to use, if any. But what you want to leave them with is, when you're ready, I'm here to help you get to those resources. So this also came from the Make It Okay. You can find it all over. What not to say and what to say. So don't say things like, oh, after somebody shares something with you, it could be worse, or, oh yeah, it's tough, but we just got to snap out of it and get on it. Everyone feels that way sometimes. How belittling. You don't know what somebody's experiencing there. We've all been there. People often push back on that one because they think it is showing empathy. And it does show empathy, but you also want to recognize that maybe they're not quite experiencing what's been there, or maybe you want to follow it up with, we've all been there and this is common, but, sounds like it's really hitting you hard right now. So validate their feelings. Pull yourself together, what's wrong with you, and then try thinking happy thoughts. Enough said on that one. So what can you say? Again, thanks for sharing that with me. How can I help? Do you want to talk about it? And the answer may be no, and that's fine there. I'm sorry to hear that. That sounds really tough. I'm here for me when you want to talk. If you're comfortable, can I help you get to an appointment? Do we need to make a phone call? You want to call somebody to talk to somebody right now? I'll go with you. And then after they've shared it with you, it's okay to check in with them. It's all right to say, how's it going today? They may open up and share more, or they may just say, it's fine, or it's an okay day. But that's good. It kind of acknowledges that. Now, you also need to know your own limits. You may not be comfortable having in-depth conversations. You may not know what the resources are. I would recommend that we all learn where the resources are, but, do what you're comfortable with, but try to build your skills there. You can never promise total confidentiality or agree to keep a secret. If somebody has indicated that they're going to harm themselves or others, that does need to be addressed directly and right away. And you need to be open and say, I want to know what's going on, but I need to tell you, in my position, I would have to report this to HR, or I would have to, I would want to make sure that you got the treatment that you needed. You could ask if they want help connecting with a specific support. So if I'm not comfortable doing it, I may say, I'm feeling a little over my head here, but I know I want to help you. Let me take you to here. Let's call somebody together, do that warm handoff. And for supervisors, know what the employer's protocol is. And I know it varies because you're working on different sites and different things, but that's really a good opportunity maybe for a next step here. And again, if there's any risk of self-harm or harm to others, you have to immediately respond and contact emergency services. So some of the red flags that may trigger that call to emergency services is somebody who's talking about wanting to die or to kill themselves. Saying phrases like, I just can't take it anymore. What's the use? Nobody cares if I'm here. If they're looking for a means to kill themselves, looking online or obtaining a gun, those are also red flags. Feeling hopeless or having no reason to live, especially if that's a change in behavior there. Less serious is, somebody who's feeling trapped or in unbearable pain, being a burden to others. We may see changes in behaviors. Maybe they're drinking more, they're starting to use drugs. They may be anxious or agitated, start taking a lot of risks, maybe not doing the safety precautions, not wearing their seatbelt, driving fast, kind of like, yeah, let's just let it happen. We'll see changes in sleep. Sometimes people can't sleep. Other times they can't wake up. They're just very depressed. Withdrawing or being isolated, so somebody you've always had lunch with who no longer wants to join you, check into them. Rage, anger, extreme mood swings, other signs that you need to check in with somebody. So who do you go to? HR, learn what's in your benefits. I've talked a lot about this. Know what's offered, know how to contact providers for you and your family. And if you're a supervisor and employer, if you're the upper level here, start looking at the data from these programs. Who's using them and for what conditions? It's de-identified. You won't know individuals, but you can start to get a sense if there's a problem within the organization. We all have performance evaluation. We get check-ins from our supervisors who tell us how we're doing there. Unfortunately, it's when somebody's not doing well is when we drag them in there. So we see a change in a behavior and we're like, what's going on? You're not following the rules. You're not doing things the right way. You're late to work. Ask about mental health then. Ask them what's going on. Use those open-ended questions and say, I've seen some changes. It's like, what's going on? You were never late. And this last month, it's been really hard. Is everything okay? Can I help? But these are good opportunities to have those conversations, but don't wait till it gets too bad. Essentially, you should think about suicide prevention and mental health as a physical condition, and it should be handled no differently than any other medical condition. If somebody says that they're experiencing pain or somebody's dealing with diabetes, you treat them the same way. Somebody has an illness or an injury, we're going to think about trying to keep them at work, and we may use something like job accommodations. And just like we would for a physical hazard, we can do this for mental conditions there. So the one at the bottom, managing treatment and medication, that's a really important one, because if you're suffering from depression or anxiety and you do go to the doctor and are prescribed pills, it's not going to be an immediate effect. It's not like when you have an ear infection, you get your antibiotic and you're told you should feel better in 24 to 48 hours. That's not how these medications work. They start at a small dose. There may be side effects. These side effects may be so unpleasant that they are not worth it, but there's other options there. But it takes a couple of weeks to take them, and then you go back to the doctor and they say, well, how was that? Not good. Okay, let's try this one. A couple of weeks. That was better. Okay, let's try to increase the dose. And so it can take a long time to find the right medication and the right dosage, and then it may need to be changed. So this may mean that people need time off to make those appointments. They may need to take frequent breaks or rest periods. Maybe you need to just let them have a water bottle so they can take their medication. But thinking about how you can accommodate what an individual is experiencing is really important. And think outside the box. Employee assistance programs, those are great resources there. They are underutilized. Only like 8% of people use their employee assistance programs. Member assistance programs are very similar. They provide services for the things listed on the slide: stress management, grief counseling, financial issues, relationship problems. And they're not only for the workers, they're also available for family members, because sometimes it may be you or your wife or your kid who's experiencing something, and the EAP is a great place to help you get connected with resources. They're not a long-term solution, but they're a connector. They can help you in a moment with a single situation, but if there's more attention needed, they can help you get to other providers or resources. So I want to bring Sherry back a little and have her talk about her experiences again.
My first hospitalization and treatment, I told just my supervisor. I didn't tell the leadership team that was around me. And that was difficult because I knew I was hiding something, and it didn't feel comfortable. It didn't feel comfortable leaving, being gone, or coming back. And So the second time that I went in for hospitalization and then day treatment, I told the leadership team, and I was nervous, very nervous about doing that. And I was very fortunate that the team was very supportive. And the way that they did that was that they normalized it for me. They didn't act afraid. They didn't act as if they didn't know what to do with me. They very much just said, we wish you well. We understand you'll be out, and we will help cover in whatever way that we can. And then with coworkers, I think it was very helpful when they would just check in every once in a while and just say, how are you doing today? And just that simple small bit makes a big difference, because it just acknowledges that maybe things might not be going that great that day and that it's a struggle.
So I think Sherry really summarizes up everything I've been saying, is that if we can start talking about mental health, it's going to be a better experience for everybody. And even though it's hard, we can do it. The last thing is, I do want to talk about people who've been touched by suicide, maybe with a family member. You know, and this is a story from NAMI about somebody who lost their son to suicide. And their son had struggled with mental health, mental illness, and he ultimately took his life. But people didn't know what to say or what to do. And, you know, it was almost as though he had committed a crime there. And, you know, what the saddest part is that even though his parents didn't have any impact, there was stigma around the response towards them. You know, they've lost their son. What a tragedy. Yet people were not comfortable talking with them and not reaching out to them and not helping them and offering the same support we would if he had died a different way there. So we need to, again, know that we are all touched by mental health. And even if you don't know what to say, just be there, reach out, and create an opportunity to talk about it. So we can do this. Mental illnesses are treatable. Recovery is possible. We got to get people to treatment, though. And so that means we got to get rid of the stigma. And then we want to start thinking about mental illnesses or mental wellness handled the same as any other medical condition. Should be the same. So I will end there. The rest of this is just some examples of resources you are welcome to use. We partnered with Turner Construction here in Des Moines, or Altoona, and they did a really good job integrating mental health into their workplace. So my colleague Anne-Marie Dale from Washington University worked with them, and we created a video telling their story. We can talk about workplace solutions and then other resources that are available. And as always, 988 is there if you need it. And I am always happy to talk to people no matter what. So thank you very much for this time.